Good morning, folks. This is John Adamson, the Rehab and Documentation Guru, heading to a work meeting on I-95 in Virginia, which is fairly quiet, which is unusual. Anyway, I wanted to talk to you today about subjective reporting. So back in the day, I was an outpatient therapist, and we regularly stacked 3 patients an hour. Even on days when I was doing evaluations, I might get like 15 minutes alone with that patient. And that would be about it. I'd try to crank out an eval. I'll never forget, I had this one guy come in who was middle-aged, and I was a young therapist. And the guy he clearly had some psychological issues. And I was trying to guide him in his subjective reporting. Like, he came there with a certain diagnosis, and so I thought, a good way of asking him questions to really get to the root of his problem, I was trying to pinpoint him on what his symptoms were and what activities were bothering him, things like that. And he was just like rambling on and on about different things and giving me this extensive history, which I thought I really didn't need. And at some point, I just said, "Sir, if you don't mind, I'm going to need to guide you in your answers, and I really need you to stick to yes and no on the questions that I'm about to ask you for answers, so we can get through this evaluation." Anyway, he looked at me kind of hurt, and I felt bad immediately, but I knew that I had other patients that were going to be waiting for me soon. And anyway, bottom line is, I didn't do as well as I could have with that patient. Didn't give him a chance to really flesh out why he was there. I didn't connect with him. The other thing I want to say about subjectivity with reports is not related to a story like that one, but the fact that if you don't spend time with your patient, sometimes you're going to miss valuable information. So I'm sure a lot of you have been in situations where you did evals and you thought, I've got what I need, and you started to proceed with treatment, and then lo and behold, like a day or two later into treatment, the patient tells you something, you go, "Wow, I wish I'd known that when I got started. I wish I had paid better attention to some of what this person's trying to tell me, because it would have guided me a lot better in my clinical approach." And we do that a lot, partly because we live in a productivity culture where we've got to get so much done, and it doesn't allow for good talking with your patient. So I guess I'm just encouraging you today, if you get in a rut where the productivity clock's ticking and you feel pressured to get to the objective parts with assessment and treatment, don't forget the value of the subjective reporting. Because oftentimes, it best guides us in what we have to look at, and it really helps solidify that patient-clinician relationship as well. Anyway, John Adamson, the Rehab and Documentation Guru. Hoping you have a great day. Take care, and God bless.